Welcome to the Social Workers Talk Show. The Social Workers is a show that's broadcast here at WCDB FM Albany by the School of Social Welfare. My name is Eric Hardiman, and I'm here with Alyssa Lotmore. Welcome back, Alyssa.
Hi, we're excited for our November show.
We are very excited. Today we've got two special topics to talk about. For the first half hour, we'll be talking about health care, the Affordable Care Act, and an exciting program here at the School of Social Welfare at UAlbany, which is called the Navigators program. And we have three students, master's students from the School of Social Welfare, who we'll introduce in just a moment. And they work for the Navigators program, and they'll be able to talk us through exactly what the Navigators program is, the history. We'll be able to talk about the Affordable Care Act, health insurance today, and some interesting topics for the first half hour. After that, we'll be having Nancy Chiarella on at 9:30, and she works for CARES Incorporated here in Albany, and we'll be talking about homelessness, housing, and shelter, and how that works here in Albany. So stay tuned for the next hour. You'll be listening to the Social Workers. So Alyssa, my co-host, has a quick announcement here.
Well, the School of Social Welfare and the Center of Excellence in Aging and Community Wellness has joined forces with the Albany Guardian Society in what they hope will be a historic event on November 21st from 8 to 11 at the Marriott Hotel, 189 Wolf Road in Albany. The event will address opportunities and challenges in changing approaches to the aging health. So their host will be Corinne Ryder, the executive director and treasurer of the John A. Hartford Foundation, and she'll speak a lot about widespread dissemination of evidence-based approaches to health in older adults. So as she's beginning to set to retire, this will be a good event to sort of say their thank you and a farewell. And it'll also launch the 50th anniversary of the School of Social Welfare, which is a really big event for the school. It will also mark a formal launch of a statewide training program, which will will show the technical assistance and evaluation support dedicated to advance evidence-based health promotion and self-management. So that's a really exciting event for the school. Again, it's on November 21st from 8 to 11 at the Marriott Hotel.
Great. Thank you, Alyssa. So if you're just tuning in again, you're listening to the Social Workers here on WCDB Albany. And we have three special guests in our studio this morning. We have Katie Merrill, who is a second-year Master's in Social Work degree student. We have Emily Vivian, who's a first-year Master's student. And we have Emily Jacobs, who is a second-year Master's student. And all three, we'd like to officially welcome you to the show and look forward to hearing about the Navigators program. Welcome.
Thank you. Thanks for having us, Eric.
Well, I'm really excited to hear about the Navigators and the Affordable Care Act. And with the elections this past Tuesday and the Republicans taking back control of the Senate, it's interesting to see how the Navigators program might change in the next few years. But I would love to know a little bit more about what it is you're doing, sort of an overview of what the Affordable Care Act and how the Navigators have been assisting with this.
Okay. Well, basically, the Affordable Care Act, or the ACA, which is formerly known as the Patient Protection and Affordable Care Act, it was signed into law by President Obama on March 23rd, 2010. It is a long and quite complex piece of legislation, and basically it allows people to have new quality health insurance options. And it, if people choose not to comply with it, they will be faced with a penalty, which is a fee at the end of the year. In 2014, that fee is $95 per adult and $47.50 per child, up to $285 per family, or it's 1% of your family income that's above the tax filing threshold. So whichever is greater. So basically, this is something that's in place to help New Yorkers and help individuals, have better health care options.
No, overall, it seems like a great program. How many people, do you have any idea of how many people are positively affected by this? How many Americans, how many New Yorkers are affected by this?
There's a lot of Americans affected by this. What I wanted to mention was 105 million Americans are no longer, they don't have to be worried about having lifetime dollar limits on their coverage, and 17.6 million children no longer have to worry about their pre-existing conditions. They are able to have health insurance without being denied coverage.
So healthcare in this country has been, an interesting topic lately. It's been a topic in the political realm, in the public realm, and it gets complex for listeners, I think, sometimes to really, and for us to understand sort of what the implications of the changes in healthcare are. So I don't know if any of you would like to talk about that a little bit, maybe sort of the general impact of the ACA, the Affordable Care Act, and maybe what that means for uninsured Americans in general. Katie, do you want to take that?
Yeah. So the Affordable Care Act did a lot of things to expand consumer protections and your rights when it comes to health insurance. People who have pre-existing conditions no longer have to worry about being denied health care. As Emily mentioned, there's no more lifetime dollar limits, so someone with a chronic medical condition may have previously been cut off at a certain point in time, and that can't happen anymore under the ACA. There's also the Medicaid expansion, so people earning up to 138% of the federal poverty level are now eligible for Medicaid, which is covered with zero premium. And that affected, I believe it was about 30 million Americans, was it, the expansion? So there's a lot of people who now have increased options under the Affordable Care Act. In New York, we have our own marketplace. So we're not under healthcare.gov. We're actually under NewYorkStateOfHealth.org or .gov. And so we are able to go on there and compare plans. Whereas before you would have to call insurance companies and get quotes and give them all kinds of information about your medical history. None of that is required anymore. They can't discriminate in New York State based on your medical conditions or based on your age.
Can you talk a little bit about what the marketplace is exactly? Is it a website?
Yes, the marketplace is a website. It's basically like Amazon or like eBay, except it's only for health insurance. You can go on and put in your information, your income information, your basic demographics, your household size, and then it tells you what you're eligible for, and you can compare plans side by side. You can look at deductibles, premiums, co-pays, co-insurance, and if you're meeting with a Navigator, we're there to walk you through all of that, because I know that the language can be scary or unfamiliar, and we're definitely there to help educate you on what's available.
Great. So maybe that's a good segue in to tell us what exactly is the Navigator program, and what is a Navigator for our listeners?
I'll start off with that one. So a Navigator is certified by the Department of Health to use the marketplace and help people complete the applications. So we have done hundreds of these applications. We know what the questions mean and what answer they're looking for, because they can be a little bit ambiguous, or things like household size can be really confusing to other people. We're trained in all of that. We're certified, and our job is just to help people pick an option that's right for them. We don't get paid based on the number of enrollments we have. We don't work for any specific health insurance company. We're really just there to advocate for the consumer.
Go ahead, Emily.
And just to stress on the confidentiality aspect of it all, because I know sometimes that can be a concern for most people, all of our appointments, they're done face-to-face. So nothing's done over the internet or, anything over the phone, which makes it a lot more confidential for people. Their information's not in cyberspace somewhere. All of our meetings are done in quiet places outside of earshot of other people. So if people are concerned, because they'd be giving us their social security number, so nobody else hears that. And also on that note, we have our laptops with us at each appointment. So if they prefer to input their information, we can just turn the computer to them and they can take care of it themselves. We do read them a privacy statement so they know what to expect, but they are also given the option to continue the application themselves if they choose to do that on their own time. And their information's never exchanged with anybody else, not even within our own program. Our own clients are our own clients, so we protect their confidentiality and privacy that way. And if we ever need to call the marketplace on their behalf, they need to be there with us. So they'll need to get on the phone and okay it that we're allowed to exchange their information.
Now, I just had a question for you. Just from my experience with working with clients, sometimes there has been a resistance to going to the doctor, or based on past experiences, based on maybe they felt they weren't treated well at the doctors, or there was some hesitation to them, or even just life events prevented them from having the time to make doctor's appointments. Have you encountered any resistance among the individuals you're working with to sort of take that step to enroll in healthcare and to go to maybe a doctor or a primary care physician? Has there been any type of stories or encounters where people were unsure about why they should actually take part in this?
Yes, actually, we see this quite often. We have people, come to us and sit down. They make an appointment, and of course, we encourage them to fill out an application. But yeah, there is that. They're nervous. They don't know what to expect, and so what we have on file, on hand, is some information to hand them. If they're confused about a copayment or if they're confused about a deductible, it really explains what that is. And once they get their card in the mail, we encourage them to come in if they have any questions about that. But yeah, it can be a scary thing. There's so many people who have never had insurance before. There's a lot of people who come in, they fill out an application. I had one last week who didn't realize that she qualified for Medicaid. And she was just there to enroll her 2 children. And she actually qualified. She was under the 138% FPL level. So it was really nice to not only enroll 2 people, but, the mother as well. So you never know. But, the whole push with the ACA, too, is about preventative care. And we need preventative services to be available for, all of our citizens. It's very important.
And even when the Affordable Care Act was, they were debating whether it was even going to become a law, there was a lot of negative feedback from some of the population in America about, healthcare is a responsibility, and there was just some people were not as open to having healthcare be a basic right for its citizens of the country. And can you explain what are some of the reasons why you've heard that people just didn't have healthcare? Sometimes there's just this image in mind of someone who's not, contributing. It should be something that they're doing. It's their responsibility to get it. What are some of the stories that you've heard of why people just don't have healthcare and why this is benefiting them?
Sure. Healthcare in this country is very expensive. We've been faced with, I've seen a lot of cases. People come in and they say that they're paying, $1,000 a month for a plan, and they don't understand why it's so high, and they're only paying it because they need insurance, and they're afraid that if something were to happen to them, and they are correct, that they may be faced with a large hospital bill. So with the ACA in place and the health insurance marketplace, people now can receive tax credits, and we'll talk a little bit more about that. But these tax credits help bring down the price of a plan on a monthly premium, and it really adds up. I've seen one person in particular was paying $1,020 a month on a health insurance plan, came to me, we enrolled them last year, and is now paying just over $200 a month for that exact same plan. So there's a lot to be said for the ACA, and we're very proud, and we're very fortunate to have it.
So it sounds like the Navigator program, in some, particularly for our listeners, is a program that helps ease the implementation process of the ACA, that helps individuals who are uninsured get access to insurance. And it sounds like, from what I'm hearing from you, that the Navigators are able to work hand in hand with people that need insurance to ease them through the process, to answer questions they might have. I'm wondering how many Navigators are there, and how do you find the people that you're trying to hook up into health insurance?
Well, there are right now 8 Navigators, and we're all Masters of Social Work students at the School of Social Welfare. We all started, there's 4 of us who started last year, so we've been Navigators for just over a year now, and we have 4 new Navigators who have joined the program. And we have done a lot of different outreach to various community organizations. Typically, because the School of Social Welfare doesn't provide direct services, we need to reach out to community organizations to engage with their clients. So we have worked with a variety of places. I'll let Emily Vivian talk about some of the organizations, but essentially we have looked at where we already have those connections and who we are best able to assist. One of the things that's different about a social work student navigator is that we have a unique skill set, and there's really a value added in having a social worker who's trained in assessment and providing that education and providing that support, and who's willing and ready to meet a client where they are in the process. So we have a very different skill set from some other navigators, and we're willing to use that and to engage some of the more difficult populations, but also just anyone who needs our help. So Emily, do you want to talk about some of the organizations we work with?
Yeah. So we serve a lot of different populations, but mostly we serve underserved populations like the homeless and refugee populations. And we can also enroll inmates in Medicaid even when they're incarcerated, and we can follow up with them upon their release to update their applications and update their enrollments. Like Katie said, a lot of our clients, they aren't familiar with the Affordable Care Act, and a lot of them just aren't familiar with the terms used, so that makes our job so much more important because we're there, like she said, to walk them through the process and explain anything that they don't understand and to help simplify the process and just be patient with it. We also do work with middle and upper class individuals, and we assist them with choosing a health plan that not only can benefit them but also their families, and just match them up with something that suits their needs. And we're also looking to enroll more college and graduate students that might not be covered by their parents' insurance anymore, or are just looking for a more affordable option to get them through the next few years while they're in school. But we do meet clients for appointments at various locations throughout Albany, Rensselaer, Schenectady counties, as well as Columbia and Greene counties. We're at Columbia Greene Community College and Greene County Mental Health Center. We also go to Unity House in Troy, the SUNY Albany downtown campus. That's very convenient for a lot of people that live in the area. Planned Parenthoods in Albany and Troy, St. Peter's and Ellis hospitals, and we also take appointments at Capital City Rescue Mission and the U.S. Committee for Refugees and Immigrants, as well as several jails in the area.
Yeah, so I'm struck listening to you by the reach of this program, and you're really reaching through the Navigators program a wide swath of the community. And to me, it sounds like a very exciting example of the university being engaged in the community. And although, as Katie said, the role of the university primarily is education, there's also a role to connect with the community, to help the community when there are needs. And it seems, to me, it's very exciting that you're doing this.
Yeah, definitely. We serve a lot of diverse populations, and a lot of people, they just haven't had health insurance before. So it's exciting for us, but it's also exciting for them that, we can make it easy for them and affordable as well.
And you mentioned the various community organizations with which you collaborate in order to recruit individuals that you work with. How do you find the organizations, and how do you connect with them and convince them that working with the Navigators program is worthwhile?
We had a really great principal investigator, someone who was working on our grant last year, who had some excellent connections in the community, and he got that process started. His name was Bruce Stanley. He really reached out to a lot of his connections and agencies he had worked with before. Since then, we've, on our own, we just go on Google and look up, okay, we're good with working with homeless populations. What other homeless shelters are around? Or we've gotten pretty skilled at working with incarcerated individuals, so we've reached out to the other correctional facilities. We have gotten very skilled working with refugees, and the U.S. Committee for Refugees and Immigrants actually reached out to us. They had heard about our work and reached out to us. So a lot of it is just word of mouth and random cold calling, and we meet with agency directors and lay out what we're able to do, who we've worked with in the past, and we really don't need much to work. We just need a private room, Wi-Fi, and a phone, and then we're ready to go. So it's really not much of an imposition on these agencies to have us there. So.
What has it been like? I mean, that sounds really like you're making an impact on a huge portion of this local community, and what is it like for you to be a part of something like this? When people ask, what is the Navigators? What are you actually doing? What do you feel that you're contributing? What does it feel like for you to be a part of this big picture in the whole healthcare system?
I have definitely learned a lot, especially from working with such a varied population. I was new to Albany last year, so I learned a lot about our community, a lot about the people who live here, and a lot about the Affordable Care Act and insurance. You pick up on it pretty quick, and it's really neat to be able to have my job being educating people on insurance, because I learn that way. So every time I go through a new or different experience with a client, their circumstances are always a little bit different, I learn something new about the ACA. So that's really interesting. I'm trying to think of a good example. I know I had one family where they were refugees and the father was still in Malaysia, and the Medicaid wanted contact information for the father, and he lived in a refugee camp. So I had to learn how to go through that whole process. So every single client, they all have something like different about their application, and it's always an opportunity for me to learn more about the Affordable Care Act and about their rights and how to negotiate different situations.
Emily?
Yes, I just wanted to share, a quick little story along these lines. I had a client who came to me. She actually had missed an appointment and came in, and I sat down with her on my lunch break on a Saturday. I had a class going on, and it was the only time, and she needed to see a navigator pretty quickly. So she came to me. She had a daughter who needed to have some health insurance. It was an immediate situation. She was basically in tears, and she needed to do this, that day. It needed to be done. And I sat down with her, and we enrolled, and I just that look on her face and knowing that, this is something she needed. She was so stressed out about, and here she's trying to do the best thing for her daughter, and having the availability to come in to enroll with the SUNY Albany, MSW Navigator program, she was so thankful, and that to see the happy tears, I can't even tell you. And that's why we do our job. This is why this is so important to us. It's those situations where these people they need our help, and we're fortunate enough to be there to help them. And it can get quite emotional, and that's part of what we do, and being a social worker, and it's a great feeling to be able to be there for anybody who needs it.
Yeah, thank you for that story. It's really remarkable to think about the human impact, and also from the flip side to think about what this community might be like without a program like the Navigators. I think is another way to look at it, and you're clearly making a difference out there. Maybe along the lines of Alyssa's question, I'm curious. So you guys are in the master's program in social welfare here at the University of Albany, and you're getting a wonderful opportunity, it seems, to apply what you're learning in the classroom out in the community, to work with real life situations and problems, and to help hook individuals and families up into the health care that they so desperately need. How do you see that sort of influencing your career development and your personal trajectories after graduation?
Well, every situation's different, so it sort of gives you experience with a lot of different populations in the community. And there's also something to be said where, we're a part of this process with them, and we're helping them along the way. So we are, learning to increase our patience levels and just our ability to educate them on their options as well. Just being able to tailor the conversations in different areas and to different people depending on what their circumstances are. Anybody else?
Well, I think it's definitely something that is a benefit. I mean, even as I filled out health insurance forms, I was always calling somebody who I knew worked in healthcare to say, what's the best option? What do I put for this? But sometimes it is right. The application, even with someone with a master's degree, the application can be a little confusing. Am I answering this correctly? I don't want to put down the wrong information. Is this plan better? What do I need? All the things in this plan, which might be a little pricier, or can I opt for a different plan, which might be more in my price range? Is that still good enough for me? So it seems like having someone like you guys to assist with that even for the general public who might not be homeless or incarcerated, I think it's still a good program for anyone who's looking to sign up for health insurance to sort of break down what it means to fill out this application.
Absolutely. We do so many applications. We look at this form every day. We know the questions by heart, and we know exactly why they're asking the questions, so we can help people give the right answer. Last fall, I worked with a woman who was no longer working because she had cancer. It had gotten very serious, and she had pre-existing insurance coverage through the ACA that was through the federal government, but this was prior to the tax credits taking place. So she did have coverage. It was costing her $1,000 a month, and it had a very high deductible and copay. So she met with me, and I was able to talk her through all of the plans that were available and what the tax credits were going to mean to her, and what the cost sharing reduction, which is another form of subsidy, could mean to her. And then I was able to show her every single plan, and because of her unique diagnosis, she needed MRIs quite frequently. So that was a copay that she really cared about, and that was something I was able to pull up and compare across plans. And that's something that, because we do it so often, we're very used to it, and we've become very comfortable talking to people about both their finances and their healthcare needs, and what their healthcare utilization really looks like over the course of a year. Because that's what ultimately is the most important when you're selecting a plan, is knowing how much you're most likely going to use. And so for this woman, she went from $1,000 a month with her premium to paying it was probably about $400 or $500 a month, which still sounds like a lot, but it had zero copays on the chemo and MRIs. And that for her was huge, to know that no matter what happened with her diagnosis, every month she just had one bill to pay instead of all of these bills for copays and coinsurance.
Well, I mean, that's something that's really important. And I was speaking with, I attended this documentary presentation, and it was comparing healthcare across the different countries. And they were asking people in all different countries and how common is it for someone to go bankrupt, personally bankrupt, because of health care. And everyone in all the other countries said that's unheard of here. It doesn't happen. People don't, go bankrupt and can't afford anything else because of health care. And it was only in, the United States where people had said, yes, I'm bankrupt. I can't afford this anymore. My copays are just too high. I've reached my deductible. My deductible's too high for me to meet the cost of that plus the premium. So, that is something that's hopefully this Act, the Affordable Care Act, is addressing. So there's not so much of the bankruptcies while you're battling something like cancer.
Exactly. And all of the plans in the marketplace have a maximum out of pocket over the course of a year. It's different based on an individual or a family. But for most of the plans, you would never pay more than $12,000 for, I believe, a family in the course of a year on top of your premium, which sounds like a lot, but when you have a significant surgery or cancer, one of those diagnoses, that can be the difference between bankruptcy and being able to survive.
It is. And is it also, what do you find that the costs of the procedures, if people do have to pay out of pocket? I mean, I've looked at compared to other countries, and our costs seem rather higher, even to have a baby. I think my child, when I had my daughter, it cost about $25,000, and I was in the hospital a day or 2 days. It's sort of skyrocketed. Do you find that the Affordable Care Act is helping to bring those costs down to more of a reasonable level?
Absolutely. And one of the things about the Affordable Care Act, it requires qualified health plans. We call them QHPs. And they have to offer these 10 minimal essential benefits. And that includes outpatient care and, like you mentioned, prenatal care. Before and after care is before the baby is born and after the baby is born. That is absolutely has to be covered under all of these plans through the marketplace. So that absolutely helps with a lot of healthcare costs, because you have your ultrasounds and everything else is included as far as going to your checkups. The other advantage too is through preventative care is birth control. That is every month. You can go as a woman and or a man and check out. Get your preventative coverage, your prescriptions for what you need. And Katie will talk a little bit more about that.
Maybe a good segue here. I'm curious, if you imagined yourself as a listener to our show, maybe a student on campus or someone in the community who happened to tune in, can you talk about maybe upcoming deadlines? What are some of the dates in the future? What's the timeline we're looking for getting people signed up, and what do they need to be aware of as listeners and potential individuals served by the Navigators program?
Absolutely. So open enrollment begins November 15th. We're very excited about that. That is when anyone can come in and sign up for a plan to begin January 1st. Open enrollment actually lasts until February 15th, so we can enroll people anytime during that period. And we are more than happy to sit down and discuss with people their personal circumstances and what they are or are not eligible for. We can also do Child Health Plus and Medicaid at any time. We have appointments available on evenings, weekends, and during the week, and in all 5 counties. So if you want to give us a call or an email, we would be happy to set up an appointment. Email is easiest. It's navigator@albany.edu, and our phone number is 518-442-3854.
Emily?
Something else to note about our specific organization, too, is that we do offer free services. So not only are we all social workers with a unique skill set, we also provide these services for free. So that also alleviates some stress in that area, too, as to paying out of pocket for a service like this.
So someone who's looking to get health insurance and needing some assistance understanding the ACA, understanding the complexity of the healthcare landscape today, could get in touch with the Navigators free of charge, get assistance, information, and actually you'd go on the website with them on the New York State Marketplace and help them sign up.
Absolutely, yes.
Great. So we'd like to officially, we hate to cut you short, but we'd like to officially thank you for coming on The Social Workers today. So we've had Katie Merrill, Emily Vivian, and Emily Jacobs. Is there anything else you guys would like to share as a last-minute thought about the Navigators and the Affordable Health Care Act?
We just encourage you all to come out and meet with one of us and fill out an application to see, if you can lower your costs of your health insurance.
Thank you again for being on. Our next guest, I'm really excited. It was going to speak about homelessness, and we have an announcement, not from Nancy, but from the United Tenants.